Hello everyone. Welcome back to my channel. Heroin is an illegal opioid, highly addictive drug made from morphine, a natural substance taken from the seed pod of the various opium poppy plants. Heroin can be a white or brown powder, or a black sticky substance known as black tar heroin. How do people use heroin? There are usually three ways. Some usually inject, others snort, or some smoke heroin. What are the effects of heroin? Heroin enters the brain rapidly and binds to opioid receptors on cells located in many areas, especially those involved in feelings of pain and pleasure and in controlling heart rate, sleeping, and breathing. Let's discuss some of short-term side effects of heroin. People who use heroin report feeling a rush, a surge of pleasure, or euphoria. However, there are other common effects, including dry mouth, warm flushing of the skin, heavy feeling in the arms and legs, nausea and vomiting, severe itching, clouded mental functioning, going on the nod, a back and forth state of being conscious and semi-conscious. Of course, people who use heroin over the long term may develop insomnia, collapsed veins for people who inject the drug, damaged tissue inside the nose for people who sniff or snort it, infection of the heart lining and valves, abscesses, swollen tissue filled with pus, constipation and stomach cramping, liver and kidney disease, lung complications, including pneumonia, mental disorders such as depression and antisocial personality disorder, sexual dysfunction for men, irregular menstrual cycles for women. A person can overdose on heroin. Heroin overdose occurs when a person uses enough of the drug to produce a life-threatening reaction or death. Heroin overdoses have increased in recent years. When people overdose on heroin, their breathing often slows or stops. This can decrease the amount of oxygen that reaches the brain, a condition called hypoxia. Hypoxia can have short and long-term mental effects and effects on the nervous system, including coma and permanent brain damage. So you might ask that how can a heroin overdose be treated? Naloxone is a medicine that can treat an opioid overdose when given right away. It works by rapidly binding to opioid receptors and blocking the effects of heroin and other opioid drugs. Heroin is highly addictive. People who regularly use heroin often develop a tolerance, which means that they need higher or more frequent doses of the drug to get the desired effects. A substance use disorder is when continued use of the drug causes issues, such as health problems and failure to meet responsibilities at work, school, or home. Those who are addicted to heroin and stop using the drug abruptly may have severe withdrawal. Withdrawal symptoms which can begin as early as a few hours after the drug was last taken include restlessness, severe muscle and bone pain, sleep problems, diarrhea and vomiting, cold flashes with goosebumps, uncontrollable leg movements, severe heroin cravings. Is heroin addiction can be treated? The answer is yes. A range of treatments including medicines and behavioral therapies are effective in helping people stop heroin use. It's important to match the best treatment approach to meet the particular needs of each individual patient. So there you have it. Some of the information about one of the deadliest drug. Share your thoughts in comment section below, and as always, thanks for watching.